My name is Tiana Rodgers, student number 7860392, and I'm going to be doing a Safe Metamin demo. So I'm going to start by checking the correct patient. Nursing Jake. FIN is 312654987, 312654987. Date of birth is January 1st, 1960. Dr. Skills Lab. There's no known drug allergies for Jake, and it's double signed by a transcriber and a nurse for all 4 drugs. And it's currently March 18th, 2020 at 5:40 a.m. So we will be giving drugs for the 600 scheduled time. I'm going to start my first med check. So we have naproxen, 150 milligrams, PO, suspension, BID. It's March 18th, and we're giving for the 600 time slot because it hasn't been given yet. Timolol, 0.5%, 1 drop right eye, daily. This drug is given for 2200, so we will not be giving this drug at this time. Azithromycin, 500 milligrams, PO, QID. We have the 4 time slots we're giving for March 18th at 600 because we haven't given it yet. Imlodipine, 10 milligrams, PO, BID. We have the 2 time slots. It's March 18th at 600. We can administer this drug because it hasn't been given yet. At this time, I can put the physician's order sheet away because we are done with it. And I will grab all the medications that we do need. So I have naproxen, oral suspension. So this is the correct drug. We are not going to be doing timolol because it is the wrong time. Azithromycin, PO, and this is in tablet PO form, so this is the correct drug. Imlodipine, PO, in tablet form, so this is also the correct drug. So we are going to begin to prep the medications, and I will wash my hands for hand hygiene. So we are going to start with naproxen. For this medication, it does come in 125 milligrams per 5 milliliters. Our dose is 150 milligrams. So I do need to draw up 6 milliliters in the syringe. So I will be shaking our oral med. And we are going to pour into the measuring cup. And the syringe cap is just going to lay on its side so it's not contaminated. And I'm going to draw up our dose. And I'm going to put the cap back on just to get the bubbles out. Just getting rid of all the bubbles. And I'm going to pull out the remainder amount that we need. Okay, just gonna get rid of any additional ones. Okay, we do have 6 milliliters in our syringe with no bubbles, and the med is filled to the top. So I will set it inside of the med cup along with the medication itself, and I'm going to put this away in med waste and write my label. So we have NJ, naproxen. The dose is 150 milligrams. The volume is 6 milliliters. The concentration is 125 milligrams per 5 milliliters. And it's March 18th, 2020 at 600. And I will sign TRUMSN2. And that slip will just be with the others. Timolol will not be given because that's for 2200. The next drug is azithromycin. The bottle says 250 milligrams a tab, so we do need 2 tabs to make our dose of 500. So we are just going to put the 2 tabs in the lid to avoid touching it. So we have the 2 tabs. And I'm going to write my med label. NJ, the drug name is azithromycin. The dose is 500 milligrams. The volume is 2 tabs. The concentration is 250 milligrams per tab. And it's March 18th, 2020. And I'm signing at 0600. TRUMSN2 is my signature. Okay. And for the third drug we have is amlodipine. The concentration of this bottle comes in 10 milligrams a tab. Our dose we need is 10 milligrams, so we just need 1 tab. And again, we're just going to shake it into the lid to avoid touching it. And we will put it into a med cup. And we have the 1 tab. And I'll make my label. So we have NJ, we have amlodipine. The dose is 10 milligrams. The volume is 1 tab. The concentration is 10 milligrams a tab. It's March 18th, 2020 at 600, and I'm signing TRUMSN2. Okay, so now since we are done prepping all the medications, we can do the second check. So the second check is just verifying the MAR to the bottle of medication with the label, as well as the prepped medication with their volume. So we have nursing Jake, naproxen, and on the bottle, naproxen. 150 milligrams is the dose. The concentration is 125 milligrams per 5 milliliters, 125 milligrams per 5 milliliters, so our volume is 6 milliliters. I'm verifying we do have 6 milliliters with no bubbles, and the med is filled to the top of the syringe. It is a PO suspension. We have PO suspension. It's given BID. We have the 2 time slots for March 18th at 600, and on this label, March 18th at 600, so this drug is safe to give. Timolol, we are not administering because it is 2200, and we are giving for the 600 time slot. Azithromycin is the next one. So we have azithromycin, and on the bottle, azithromycin. Nursing Jake. 500 milligrams is the dose. The concentration is 250 milligrams a tab. 250 milligrams a tab on the bottle. And so our volume is 2 tabs. And I'm verifying that we do have 2 tabs. It is a PO drug, so we have tablets in PO form, given 4 times a day for March 18th at 600, and on the label, March 18th at 600, so this drug is safe to give. The last drug we have is amlodipine on the bottle, amlodipine on the MAR, and amlodipine on the label. Nursing Jake, 10 milligrams. The concentration is 10 milligrams a tab, and on the bottle it says 10 milligrams a tab. So for our volume, we just have 1 tab. It is a PO drug, and it says tablets on the bottle, so we know that's PO form. Given BID for March 18th, we're giving for 600. March 18th, we're giving for 600, so this is safe to give. So we finished our second check, and all the meds are prepped properly with the right dose. We are going to bring everything to our patient's room. So we have the MAR, the 3 meds that we're giving, along with a pencil for documentation and a cup for the oral meds. So we're going to walk into our patient's room and enter and do the safety check. Everything is safe, and I will do hand hygiene. And I'm going to identify myself as well as identify our patient. We are going to be using the coffee cup as our patient with his wristband. So good morning, my name is Tiana Rodgers, and I am a student nurse at the University of Manitoba. I'm going to be giving you your medications today. Can I get your first name and your last name? Nursing Jake. Date of birth? January 1st, 1960. And do you have any allergies? No allergies? Okay. I'm just going to verify that information with your wristband. So we have Nursing Jake. Date of birth is January 1st, 1960. January 1st, 1960. And there's no allergies. And we also have no known allergies on here, so that's great. And we are going to lift Jake up to high Fowler's position for the oral medications. And after I do that, I will come back and we are going to work on the third check. So I have Nursing Jake, naproxen, 150 milligrams, 150 milligrams. The concentration's 125 milligrams per 5 milliliters. So I do have 6 milliliters as the volume. I'm going to verify the volume. I do have 6 milliliters, no bubbles, and the medication is at the top. It is a PO suspension. We have it here, PO suspension, given BID for March 18th at 600, March 18th at 600, so this drug is safe to give. Timolol is not going to be given because the time is 2200 for that drug, and it is currently 5:40 a.m., so we will not be giving this drug at this time. The next drug is azithromycin, Nursing Jake, 500 milligrams, 500 milligrams. The concentration is 250 milligrams per tab, so to get our dose, we needed 2 tabs, and we do have 2 tabs in here. It is a PO drug, as we have it in tablet form, given 4 times a day for March 18th at 600, March 18th at 600, so we know that this is the correct drug to give at 600. Amlodipine, Nursing Jake, 10 milligrams, 10 milligrams. The concentration of the bottle was 10 milligrams a tab, so we only needed 1 tab as our volume. It is a PO drug, so we have it in tablet form, given BID for March 18th at 600, March 18th at 600, so this drug is safe to give. So now, since I've done my third check, we are going to do patient education before we administer, and again, Jake is going to be in high Fowler's position. So for naproxen, this is for your moderate level pain that you are experiencing. We have already done a pain assessment on you previously, and we've checked your current health history. You're not on any anticoagulants, and you don't have any bleeding disorders, so this drug should be effective for you. 3 side effects you may experience would be a high heart rate, drowsiness, or dizziness. We're going to continue to monitor your pain afterwards as well, along with all your other vital signs. And with this drug, it is important to note that if you do experience any bleeding, just to let your physician know, because this drug may need to be discontinued. So here is the naproxen and the water. And I will document that I did give this to Jake, TR0540, UMSN2. And I will show the camera. Timolol we are not administering because this is not the right time. This is for 2200 and we are giving for 600. Azithromycin is the next drug that we are giving Jake. This is for his respiratory tract infection. It is an antibiotic. We have done a culture and sensitivity test on you beforehand, so we know that this drug will be effective. We are going to still monitor all your vital signs, which we have done previously, but we will continue to monitor them afterwards as well, specifically your temperature. And 3 side effects that you may experience with this drug would be dizziness, headache, or fatigued. And it is also important to note that with this drug, you should be taking it on an empty stomach with a full glass of water. So we have the azithromycin pills and the water. And I will document that I did administer this drug to Jake, TR0540, UMSN2, and I will show the camera that I did document. Okay, and the last drug that we are giving Jake is amlodipine. This is for your high blood pressure. We have assessed your apical heart rate and your blood pressure beforehand, and we are going to continue to monitor your blood pressure and apical heart rate afterwards, since this drug is meant to lower that. 3 side effects that you may experience would be drowsiness, dizziness, nervousness, or anxiety. And with this drug, it is important to note that you may experience postural hypotension, and to, when you're moving positions, just to do it slowly so that you don't experience a lot of dizziness. So we have your 1 pill of amlodipine and the water, and I will document that I did administer the amlodipine, TR0540, UMSN2, and I'm showing the camera. Okay, so I did document all 3 drugs that I did give. I'm going to make sure that Jake is at a safe level at the lowest height of the bed possible, and his head will remain in high Fowler's position just to absorb the meds properly. Here is a call bell for safety, Jake. If you experience any of those side effects, you can give us a call and we will come and check on you. But we will be back in about an hour anyways, just to reassess your vital signs, specifically your temperature and your blood pressure, as well as do another pain assessment on you. As I exit the room, I'm going to make sure that the room is safe for Jake. Yes, everything is safe.